You're watching Baptist Health's Resource Live, where our respected experts bring you timely and practical health and wellness information to improve your family's way of life. Hear healthcare that cares. This is Resource Live.
Hi, everyone. I'm Dr. Jonathan Fialco, Chief Population Health Officer for Baptist Health South Florida, coming to you live from the Baptist Health Newsroom. With the internet at our fingertips, the answer to most of our questions is just a few keystrokes away. Many search for reasons why they may feel a certain way in a web browser, even before making an appointment with their doctor. We put together a list of the top searched health questions and have experts from the Baptist Health family here to provide us with answers. For today's Facebook Resource Live, I'd like to welcome Michael Dukoski. Mike's the Assistant Vice President of Pharmacy Administration at Baptist Health South Florida. Great to have you with us, Mike.
Thanks for having me.
Dr. Liana Barkan, Internal Medicine Physician at Boca Regional Hospital. Thanks for being here, Liana.
Pleasure.
And Dr. Katie Aquino, Medical Director of Baptist Urgent Care Express in Palm Beach. Welcome, Katie.
Thank you.
Thanks for all you being here today. It's a pleasure to have you. Before we dive into today's subjects, I want to remind our viewers to send in your questions and comments throughout the segment. We're here for you and happy to answer any questions you may have. So let's get started with some of the top searched questions that we found on the internet. Liana, one of the top search questions has to do with something a lot of people suffer from, and that's hypertension, keeping our blood pressure levels in check. For those who suffer from high blood pressure or who are interested in managing it, what would you say is the best way to lower your blood pressure?
Well, if you're on medication for blood pressure, I would definitely suggest taking your blood pressure medicine, that's for sure. Outside of taking your medication.
I think we lost Liana.
In your meals.
A little bit. We lost you for a sec, but that's okay. That's modern medicine. So go back as far as obviously taking your medications of paramount importance. Why don't you follow up?
Oh, right. And then I was just saying to eat healthy and regular exercise and to keep your BMI within normal limits, and just in general, eating a healthy, moderate diet is very important.
Isn't that kind of the common denominator for everything? We tend to individualize about the disease states, but it's, as you just said, exercise, keep your weight under control, eat healthy foods. Well said. What about sleep? I know we've had previous resources programs about sleep. Can you speak a little bit about the importance of getting a good night's sleep?
Well, it's actually extremely important because if you're sleep deprived, the rest of your health is invariably impacted. If you don't sleep well, you don't tend to eat as well. If you're not eating as well, you're feeling more tired. And it's hard to maintain a healthy lifestyle. But even independent of how you function, sleep in and of itself is a restorative process. So it's important to sleep well so that the rest of your bodily functions are working at their optimum.
So when you have patients, and again, either you're speaking to them about high blood pressure or they're asking you, you go through those components with them and give them instructions towards, again, healthy eating, exercise, good night's sleep. Is that fair to say?
Absolutely. Absolutely. It's all part of the process. It's a holistic picture. You have to look at every component. It's not just, you take your medicine and then you don't do anything else, or you eat well, but then you don't do anything else. It has to be a comprehensive, holistic picture. That's
a great response. And I love the way you started, which is when you're prescribed the medications, they only work if you take them. So let's not.
Can I weigh in on that for just a moment?
Sure, of course.
Working in pharmacy, we see so many patients who irregularly take their medications. And, just like you're both saying, it's so important to consistently not have gaps with taking medication. So we encourage patients to have a good routine about when they're going to pick up their refills for their medications, make sure that they always have enough refills on hand for any vacations or things like that they might be taking. And also, if you're not able to afford your medication, don't let that be the barrier to stop you from taking it regularly, because there are lots of medications and also a lot of resources to help get discounts on medications available. So if you can't afford your medication, I just want to say that it's so important to talk with your doctor about alternatives that can help keep your blood pressure, for instance, under control, but also allow you to, afford the medication.
I appreciate that, Michael. We work together on quite a lot of initiatives to get people their medications under those very concerns, pick them up, help getting them delivered, help if there's an affordability issue. And again, we want people to make sure that they speak with their doctors if they have trouble filling their prescriptions for whatever reasons. Katie, another one, certainly as the preventative cardiologist, another frequently searched question has to do with cholesterol levels. What can people do to lower their cholesterol, assuming that there's someone who should lower their cholesterol?
Yeah, sure. I mean, so the big deal with this is that there's modifiable and unmodifiable things. So you can't help what you're born into. So we're not going to get into that whole story. But as far as modifiable things, so there are some lifestyle things such as what we eat and just managing certain aspects. So a little bit of getting into what we eat. Some of the foods that will help would be eating fish with high in omega-3. It helps a ton to lower some of the cholesterol. If you do that at least 2 times a week, that's great. Foods in high fiber, such as grains, whole grains, beans, apples, broccoli, also help in that situation. Of course, we need to avoid processed foods that are fried, anything with added sugar as well. Another little thing that I like to tell people is try to meal plan. And I'm not talking about meal planning because that's a complicated thing, but just as far as what you're putting on your plate. So, I like to say divide it up into fourths. So you basically say a fourth of your plate should be whole grains. The other fourth should be the low fat proteins, and then the rest of it should be all vegetables. So if you look at meal planning in that way, it's kind of a little bit easier to have a concept of being able to lower cholesterol that way.
That's a great response. And I love the way you approached it towards eating the healthier foods, the less processed, refined foods, which is really what we were meant to eat. We didn't evolve eating, cookies and crackers and things like that. Speak a little bit about also, as Leanna mentioned, about medications, where obviously we want a lot of people to be able to control their cholesterol, to decrease their risk of cardiovascular disease. That's the concern, heart attacks and strokes, without the need for medications. But if someone's prescribed a cholesterol lowering medication, what recommendations would you have towards making sure they take those medications?
Yeah, I mean, it kind of piggybacks back off of both what Mike and Leanna said. It's if you're prescribed it, you're prescribed medication for a reason. And we just really want our patients to understand that it's important to take it and to take it on a regular basis because it's there to help and it does help.
Great.
Can I interject? Oh, I'm sorry.
Please,
I just wanted
of course,
to say,
no,
yeah.
please. This is
I was going to say, and it sort of piggybacks on both of them said, obviously, if you don't take your medication, it's not going to work. But if you do take your medication, it will work. But you can't stop taking it because it works. I've had a million patients who've come to me and said, but my blood pressure is normal now. I don't have to take it anymore. I'm like, it's normal because you're taking your blood pressure medicine. Likewise with the cholesterol. So, I think it's really important to talk to your doctor if your blood pressure has been normal for a long time. Maybe you can discuss other alternatives, but to continue taking your your blood pressure, even if your blood pressure is controlled and the cholesterol is controlled. So
I love that. I tell patients, when you put all the aspects of where you are in a blender, your age, your gender, your weight, your exercise, your diet, it comes out you're hypertensive. We control it with the medications. We don't cure it. If you change something major in your lifestyle for the better, maybe, but because it's controlled doesn't mean you stop the medication. So well said. Next question's for Mike. We'll start getting to a couple of COVID questions. I actually had this text twice this morning from 2 different patients. As the height of the pandemic subsiding, many questions are related to COVID-19. Like we said, do patients need to get a booster if they've got the COVID vaccine already?
Thank you. It's a very understandable question because every night when we watch the news, there's something on there about the vaccine, there's something on there about booster shots. And so it's very rapidly changing. But I think what's prudent for us to do today is talk about what we know on September 9th and recognize that what we know next week or next month might change a little bit. But in healthcare in general, when it comes to medications, we follow the guidance of the Food and Drug Administration. And in an issue like with COVID, we also follow the guidance of the CDC, Center for Disease Control. So that being said, currently, for the general public or population, there is no recommendation for a booster shot. Now, that's rapidly changing, and we do expect to get more guidance on that in the days to come. But for the general population, as of today, September 9th, no recommendation for a booster. That said, what we would call a third dose of the Pfizer or the Moderna vaccine has been recommended for those who are immunocompromised, those who have a weakened immune system. You might be someone that has a weakened immune system if you're a transplant patient, you received a transplant years back or recently. Maybe you're actively receiving cancer treatment. There are other diseases that could cause you to have a weakened immune system. So for those patients, a third dose of that vaccine is recommended because they're a particular susceptibility to get COVID and then to have kind of a bad outcome with COVID. And so if you're not sure if you have a weakened immune system or not, and therefore should get that third dose or not, particularly of the Pfizer or Moderna vaccine, you should definitely talk with your doctor. I think it's important too that you stay in touch with Baptist Health South Florida, because this information is ever changing. I think you could think of us as a trusted source for information. So when there's more information to come out about whether you need to have a booster shot of the vaccine, we'll be sure to let the public know.
And thanks, Mike. It's a very articulate answer and appropriate. It's a moving target. So as you said, right now, there's a difference between a booster, if you will, and a third dose in terms of the nomenclature. But stay tuned, folks, and certainly speak to your physician, who will be able to give you the proper recommendations at the proper time for that. Mike, a follow-up to that, which is another question I think we all get fairly frequently. If someone got the COVID-19 vaccine, should they get the flu vaccine?
Yeah, well, the short answer is yes. The short answer to that question, yes. And this is a confusing one too, because sometimes when people have COVID, they say it's like, feel like they have a bad flu, you know, and so then it can get mixed up. These are two different diseases caused by two different viruses. They may cause your body to have similar symptoms, but because they're caused by two different viruses, they have two separate vaccines. And it's very important as we go into flu season here. We've started, and we're going to get into the deeper part of flu season as we get into the winter and late fall. It's very important that all eligible people get the flu vaccine also, even if they have already had the COVID vaccine. And there's a lot of information that's emerging about that. But I think it's important to remember, if you're eligible for the flu vaccine, especially even pregnant women, go ahead and get the flu vaccine this year. And remember, it's not just about protecting yourself, but getting the flu shot is also about protecting you from being able to spread it to loved ones or other vulnerable members of our community. I mean, imagine if someone got the flu and COVID at the same time. That could be really detrimental to them. So vaccination is one of the best tools that we have to help prevent that.
And I believe the recommendation is if someone's had COVID, there's a period of time to wait until they get the flu vaccine. Is it 2 weeks from the end? Do you know what that is? Is it 2 weeks from the end of symptoms, or?
Yeah, I think in general, that's a good recommendation to allow a little bit of time. But actually, some information, the current information about vaccination with the two is that if for instance, your circumstances necessitate to get the COVID vaccine and the flu vaccine on the same day, what we know today is that would be safe to do. And like, let's say you go to the pharmacy and you say, I'm going to get the flu vaccine today. And then you also decide, yeah, let's go ahead and get the COVID vaccine. That would be okay. They recommend getting them in different locations, so you don't have, the arm pain in the same arm or something like that. But really, that's the current recommendation. If you have to, get them the same day. But if not, maybe you leave a couple of weeks go in between. That will be fine too.
Okay. So we talked about some cardiovascular prevention. We talked about COVID. Switch gears again, and we're going to bring this one to Katie. And again, these are the most commonly searched medical questions. And this one's about kidney stones. People who've experienced kidney stones say it's probably the most painful experience they have. Can you talk a little bit about kidney stones, Katie? What causes them? What can people do to prevent them? What should people be on alert for?
Sure, yeah. So I've never had a kidney stone, but having family members that have kidney stones, it's a very painful process that occurs. So kind of go back to the idea of diet again. So believe it or not, a lot of the stones that we create are due to our diet. There are 4 types of stones we can create, but the most common is a calcium stone that, once again, has to do a lot with diet, and something else called a uric acid stone. So some tips: we want to hydrate. If we hydrate correctly, our kidneys will function correctly. When we do not hydrate correctly, they're just not going to function, and then it can perpetuate these stones. Also salt, too much salt, just like it affects our blood pressure, it affects our kidneys. So we have to be careful with that salt intake, and also too much protein as well. We don't want to have too much protein or even sugar in our diet. All that affects our kidneys tremendously. So, certain things we can't help is, once again, family members that have it, we are predisposed. But, as far as if you've had a kidney stone in the past, you're also predisposed to having it again. But, the diet is something that we can help.
Do you find when patients, let me phrase it a different way, do most kidney stones require a patient to present to an urgent care or a hospital for hydration and pain therapy? Or would you say a lot just, go away at home? So when someone has the pain, do you urge them to get checked out quickly, or see if you can write it out at home and see if it'll go away on its own?
So believe it or not, there's many of us that have had stones and never even known we've had stones. We can pass stones pretty easily as long as they're small enough. The problem is when they become too large, they can't pass on their own. So that's when we have to go to the hospital. It's that excruciating pain that would require us to get some hydration, to get some pain medication. But when we're experiencing pain, our first bet is to run to an emergency room. But it's just one of those things where you have to know your pain tolerance and basically base it on that. But running to the urgent care emergency room is not always necessary.
Thanks. Switch it over to Liana. And again, this is the search questions. Alcohol consumption, we know, has increased significantly as people have spent a lot of time at home. And we've done various public service educations about the concerns about alcohol consumption through COVID. But the question is, how long does alcohol stay in one's system? And I guess a caveat of that would be, if someone drinks a lot, clearly they shouldn't get behind the wheel of a car, or what kind of recommendation we have with that. But how long does alcohol stay in one's system?
So alcohol metabolism will vary by person, as always. There's, a littler person will metabolize it more quickly than somebody who might be a bigger body habitus. But generally, alcohol stays in your system between 6 and 12 hours. And that depends also on the quantity you drink and the type of alcohol you drink. Like, it gets metabolized at a different rate. So for example, if you had, 3 beers, they have a general that it takes 5 half-lives of alcohol to get out of your system, and a half-life is about 5 hours. So that's like a total of about 25 hours. But again, it has to do with the alcohol content in what you're drinking. Like, a beer might go faster than a hard alcohol because there's more alcohol in the shot of whiskey than there is in a beer of like a 12-ounce beer.
Nice, nicely done.
So,
That's a tough question. There's a lot of variables involved. But
yeah.
I guess the take-home point is it's hours is really
Yeah.
the bottom line.
And coffee does not help, and neither does food. It does not get it out of your system any faster.
You'll
Neither
be more
does
awake
shower.
drunk, as we tell people.
That's right. You'll be a wet drunk with a shower, but it still takes the same amount of time, no matter what else you put in your system, to get out.
Fair enough. Mike, going back to you on a COVID-19 question, something actually I wasn't even aware of, and I always love learning from guests during these resource lives. So the COVID-19 vaccine apparently can cause some temporary enlargement of lymph nodes, and apparently these can show up on mammograms. So speak a little bit where we think right now that if someone has the COVID-19 vaccine, is there a recommendation towards a timing of not getting a mammogram too soon because it may show some findings not related or related to the vaccine that we otherwise wouldn't be able to differentiate?
Yeah, and let's be clear. Both of these are extremely important and should not be, in general, delayed. If you're due for a screening mammogram, you need to get that done. If the COVID vaccine is one of the single greatest things that we can do for our healthcare right now in September of 2021, if we haven't already done it. That said, when the two come together, we just have to keep this in mind. Because it can cause a larger lymph node, particularly we call it the axillary lymph node, that could show up as a false positive on your mammogram and then cause needless concern and next steps. So the recommendation today is this: get your mammogram before the COVID vaccine, or wait 4 to 6 weeks after your COVID vaccine series is complete, and then go ahead and get the mammogram.
So it's fair to say the lymph node enlargement related to the vaccine is expected. That's normal. That's your body's reacting to the vaccine. It's more of a timing of the mammogram. And certainly we know there's a lot of delays in getting appropriate medical care and screenings through this COVID pandemic. So your points are well taken, which is to get your mammogram and get the vaccine, just time them appropriately based on that recommendation. Katie, question about sexually transmitted disease. What's HPV? A lot of HPV in the news, vaccines, kids, et cetera. Speak a little bit about HPV. This seems to be a highly searched question on the internet.
Sure. So HPV is something called the human papillomavirus. It's passed easily from person to person through sexual contact. So it actually is the most common sexually transmitted infection. There's a lot of types of it. Some can cause warts or lesions in the genital area. Some can even cause cancer. And the crazy part is most people who are infected with HPV don't have symptoms. You can have it for a long time, not even know. You can even spread it without knowing it. So one of the key things here is if you're a woman, have regular Pap tests. These Pap tests can help identify changes in cells that lead to cancer. You want to talk to your GYN about how often you need these tests. Currently, there's no approved test for HPV in men, but there is HPV vaccine that can really help prevent some HPV infections and even related cancers, which is amazing, so really want to speak with your healthcare provider to see if you're a candidate for that vaccine.
Thank you. To Liana, we all have heard about the freshman 15, which has to do with weight gain when people start college, but now we have the quarantine 15, which we're certainly seeing as medical providers. A lot of people are home. A lot of people change their lifestyles. They've gained weight through COVID. What are you recommending to your patients regarding both recognizing this and getting back to a healthy weight if they've gained some weight? What again? Similar. You're getting all the tough questions with all the variables, but
no, that's okay.
What are you actually saying and saying? Yeah.
I actually thought it was the quarantine 19. They were trying to match it up with the COVID 19. But it's very hard.
It's early. We'll see.
Yeah, exactly. I've seen 10 pounds to much more over the period of the quarantine. It's very hard. It's very challenging to maintain a healthy lifestyle when the normal things that you have access to, you no longer have access to. We just moved down from the Northeast, and up there was nowhere to exercise. You couldn't go outdoors. I mean, it was really particularly challenging. Here in South Florida, obviously people were a little bit luckier, but food was the biggest impediment to, maintaining a healthy weight. So, how many calories and whatnot a person should eat, again, is very variable based on your age and your sex and the weight that you're starting at. So just as an example, women between 30s and 50s who are, lightly active, let's say, should be eating between 1,200 and 1,500 calories a day. But if you're more active, that number will go up. With men, their baseline caloric needs are higher than women, or if you're highly active, your baseline caloric needs are higher. So you have to adjust it accordingly. So basically there are ways you can figure, there are actual calculations where you can figure out what your basic caloric needs are. And in order to lose weight, you want to do about 500 less than that. So that's sort of like a roundabout way of figuring it out.
Yeah, and it's well said. And as we get older, our caloric needs change. And as you mentioned in one of the earlier answers, the quality of the food, the quality of the calorie makes a difference as well. I always talk to my patients as well that a calorie is a unit of measurement, right? It's a unit of energy. You could have a pound, which is a measure of weight. A pound of bricks is not the same as a pound of feathers, but they're both a pound. So the quality of the foods, going back to that natural, more natural, right, less processed ways comes to play as well. But again, I appreciate that answer. Mike, a couple of quick hits in the last few minutes we have. Does COVID-19 vaccine affect fertility?
Yeah, I think that's a very good question, and not surprising that it's one of the most searched questions, because we know that has been one of the things that has led to some vaccine hesitancy among our younger population. But think about this: through August in the United States, there have been 369 million doses of this vaccine administered. So with that kind of volume, we have a really good idea of its safety and its efficacy. So regarding its impact on fertility, the answer is no. There's no evidence with all those doses given. There's no evidence that COVID-19 vaccines impact either the menstrual cycle or fertility. And those who are trying to become pregnant or concerned about that in the future don't need to avoid pregnancy at all after they've received the COVID-19 vaccine.
And in follow-up to that, and I think that's well said, 369 million doses have been given. That's a large cohort of people to get knowledge from. If someone's had COVID, are we recommending they get vaccinated?
Yes, that's the short answer. If you've had COVID, take some time to let your current active symptoms resolve, and then at a convenient time after that will be appropriate to be vaccinated.
Right. We don't know how strong your immune response is and how long it lasts. So the vaccine we know does work. Let me throw this at Katie. It has to do with urinary tract infections. Can you tell us a little bit about the common symptoms of a urinary tract infection and when someone should seek professional help, for example, in urgent care?
Of course, yeah. So urinary tract infection is one of the most common complaints walking into the urgent care. It's usually just you feel like you have to go more. It might actually burn when you pee. You feel sometimes even hesitancy when you pee. So you really do notice that something is wrong. But the most common is that there is a lot of pain. So coming to an urgent care is very easy. We run your urine real quick and check it out. And if you need an antibiotic, we can prescribe it. It's no need to ever run to an emergency room with those symptoms unless you have crazy high fever or severe abdominal pain. But besides that, urinary tract infection, very simple to take care of. And if you have those symptoms, you should get checked out.
And again, very commonly searched because it's very commonly occurring medical condition. Katie, last question for you. We'll give you the soapbox. Tell us the difference between symptoms, if there are any, between flu and COVID.
That's a tough one. But I mean, coming in and out of the urgent care, patients come in actually writing they have flu-like symptoms. And right now, the flu is not as prevalent. It's not the time of year, you can say. But both of them present very similar. But one of the ones that we noticed that a lot of patients complain about is the loss of taste and smell. That is still a huge one. That's very strange to have with a lot of other viruses. So when someone complains of that, their test seems to be positive more than negative. But a lot of the fever, cough, sore throat, pretty much all of the same symptoms. So it's hard to differentiate. That's why getting tested is so important when you have those symptoms.
Great stuff, guys. Liana, I'll just give you a last opportunity. Any final comments you want to give to the viewers, certainly relevant towards what you see in your practice?
With respect to alcohol consumption, weight, hypertension, cholesterol,
everything.
there's so many different things.
Yeah.
Well, just in general, I think that the hardest thing for us to do as individuals, and this, I'm not exempt from this either, is to maintain a healthy lifestyle. There's a lot of things out there that are like immediate gratification. You're hungry, you eat a snack, and usually not a healthy snack. I would say that keeping your focus on what you put in your body as being healthy and what you do with your body and to your body is really important to how your body will respond to that. So.
Great. Really, this is fantastic, guys. Great information, responding to the questions that people are asking. And I really thank you guys for sharing your time and your insights to the audience. Remember, viewers, you can connect with us in our social media channels. That's Facebook, Instagram, Twitter, or LinkedIn. Check out the resource blog for the latest news at baptisthealth.net/news. That's baptisthealth.net/news. You'll find a link there to all the episodes of the Baptist Health podcast as well. On behalf of everyone at Baptist Health, we ask you to please stay safe and say yes to the COVID-19 vaccine. Thanks again.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Resource Live is brought to you by Baptist Health South Florida. Healthcare that cares.